Hi, I'm Evan Sachs with the Washington Heights-Inwood Mask Block, and this is Inconvenient Health. Today I am here with Ivy Kwan Arce, she, her, who is HIV positive and has been since 1990. She is a member of ACTA New York, which I'm also part of, and I'm very proud to have her as a co-activist. She is also board president of the Treatment Action Group. Ivy, would you like to go into how you got into all this wonderful activism?
Well, so I guess, I had just moved to New York in 1990, and back then there wasn't a lot of focus on HIV and women in general. So I guess I'm a good example of what activism can do um in a positive way. I mean, there's a lot of negative things that happen too, but let's focus on the positive thing. So, I was, like I said, I recently had moved to New York, and I think I was in my second job. There was a recession around that time. So, I saw a wheat paste in the subway, and that was from ACT UP. There's this campaign that the tagline is called something like "Women don't get AIDS, they just die from it." So unlike the visual one that most people are seeing, like in terms of reference that was done by Graham Fury, prior to that, it was basically a call for action. So it's a sheet that usually enact up when we're doing something. It's like, what is the situation? When is the date we're trying to do something? What are the specific things that we're asking people to engage with? So in this case was HIV testing for women. So it basically said you may not think that you're the population, because at that point it was, thousands and thousands of people dying and contracting HIV, and there were mostly gay men. So the subline kind of says something like, you may not think you're that population, but you should test even if you had been at one point sexually active with anybody, or drug use with anybody, or somebody that. So, anyways, I had a short relationship before moving to New York with somebody that was um IV user. And so I thought about that. So that kind of stayed with me. And then like I said, I just moved to the city, and I had actually been sick and um for quite a bit. And so I thought, I was looking for a general doctor just to have in this new residence. So then I brought it up. I said, I saw this thing, and they said, well, we don't have that kind of test. And they were kind of a little surprised. And then I think they they felt like if I was myself a drug user, that maybe that would they would have a different attitude about it. But there was a lot of like, we don't think it really doesn't affect women, that kind of stuff. So I kept on saying, no, no, I did date somebody that was a drug user, sorry, for for most of his life. I mean, I was young, so he was, just about the same age as I was, 25, but he had been in rehab. Um, so then I finally went and got the test for me to test. It wasn't like, like today you can have it off of the counter. So it took them a little bit to get the test, and it was called the ELISA test. So then he said to me, well, I don't think it's going to be anything, because women rarely test positive. And he said, well, but I'll call you if something happens. So he did call me at work. So it wasn't like today where there's a lot more process where you have to come no matter what. But yeah, so it was kind of like he asked me that I had to come back immediately for an appointment. Um, yeah, so that's I guess that's a good example of a call for action because you never know who you're gonna get. Um, but then, we can talk about later whether um I mean, what also happened is that once I went back there, I mean, we had a lot of silly conversations about like, oh, maybe it was that dirty bathroom or blah, blah, blah. Maybe the test is wrong. And I remember him saying the test is very accurate. I think the ELISA test is pretty accurate, but it's pre-internet, so it's like you never know. So what he did is he had called in for another another test. So we retested, but at that point he said to me that I had to take it to the infectious disease myself, the lab. I mean, it's absurd to even think that you would carry your own blood in the bus to go, because it was in First Avenue. And when I got there, the place looked like it's the infectious disease center where Aaron Diamond is. So sort of south of 34th Street. And it just looked like it could be a mistake because the place was super dirty. All the tests for all kinds of stuff were just like all over the place. And I'm like, oh, maybe it'll be negative. Um, but at the same time, he also told me that in that time he had put a lot of calls to see who can uh he could refer me. And because it was still very early in the days, he was working his connection. So he said he didn't have a name at that point. Um, so he didn't really have an advice like, oh, is it gonna be bad? I mean, at that point, everything like, the notion that it was gonna be bad. So he said to me, maybe while we're waiting for somebody to reply for referral for me, um, you should go back to that place that you saw the wheat paste. And the wheat paste was from Act Up. Obviously, I didn't register that. So it said that every Monday they were meeting. So I ended up taking my blood work and then waiting. I don't know if it was a Monday, but I went the Monday of the meeting. And then well, there's a lot of experience we can talk about what it's like to get into a room, especially I'm not a queer person. So since then till now, that's been a hard thing to navigate. I mean, now I feel like it's 35 years, but it's a constant navigation. As you know, when you go to meetings, I mean, almost everybody. I mean, I don't know, is anybody straight in the meeting? I don't think so.
Yeah,
Um,
we're definitely a very queer group even today.
so that there's a lot of things that we can talk about. What it was like to be in a space where they call women for testing, but yet there wasn't any support even in ACT UP. I don't think it's ever really been. Most of the women have to be active, do their activism with active members, maybe, but almost was never a fruitful space for us. And who were the women that held that floor also that were not positive. So if you look at the ACT UP oral history, you will see that there is not a single woman that's positive. Not one single woman is positive. Not that it wasn't, but I'm saying it's like it doesn't have to be me, but what I'm saying is like there is absolutely nobody that represents a woman that's positive in all those interviews. Um, yeah, so it's been a constant struggle, and there's also been a lot of history about like gay men taking too much of the space or all the space. But at the same time, my testimony is that had those, a few of the gay men that did not leave me behind really made a difference in my own survival. They got me hooked up with doctors that, I mean, we take it for granted. We really were in the generation that actually there was no HIV doctors. there was a lot of gay doctors, um, either in practice or people that had just finished school and this was happening. So they started like focusing in their community because a lot of gay men, even prior to the test, like people, general doctors would they would see this cancer, and they were just disgusted by what a lot of people think sexual activity perception in the gay community is with men. So gay men practitioners step it up, um, because they were not even properly like looked and properly checked. So a lot of them became later on the AIDS doctor. So I wouldn't say like you could say a lot of people they were general doctor, but that specialty just grew with us.
Yeah, it's really amazing, especially as a newer member of ACT UP, to like hear about a lot of the history and a lot of, like you said, the struggles that, you know, weren't necessarily as prominent or as publicized as they should have been and still aren't.
Mhm.
And yeah, on that note, I'm curious to hear what you think has improved and what you think still needs work even today.
Well, the Department of Health has just released the 2024 statistics of infection. So I would just say like we can't pat ourselves in the back because like when you look at the highest infections that are still happening, they're not in the numbers that we're talking about. But when they're looking at the whole population, the percentage is pretty much hovering in the same thing. It's like, I don't know, 60 something percent of Latino and Black men. The fact that even we have all these things, the percentage is still lying in the same thing, and the women are still the same thing. I mean, and that's a failure on my work too. It's like I was there when they took one drug and I mean it was on the it's I mean it's really important to put things into context, like when we talk about, let's say, COVID, and say, oh, X amount of people worked on COVID and it succeeded. But the reality is that there is decades of work, whether that was called COVID or whatever, that um the pace away. It was same thing with PrEP. PrEP did was being considered a long time before 2010, 11, where we had a lot more younger people get infected. People already forgot the history at that point, and we took the research that was done with a drug that it was used for HIV that early on had a signal that could be used for prevention, but there wasn't the priority to study it that way. So when we had the protease, a lot of people stepped back, very depleted. When I say a lot of people, a lot of HIV positive people, from the amount of death and a lot of like harm of being HIV positive within our own body. So we had stepped out. Many of us stepped out, and then suddenly we saw this continuous infection of younger people. So then activists and scientists decided, like, let's take what we've been all along trying to have this data and push it through and ask Gilead to study it so that they can have the conclusion so that it could be a preventive. They decided not to do it. So if you look in the New York Times, I believe in 2022, there's a cover story about basically a lot of pharmaceuticals. Sometimes they do have the tools, but they um, withhold it or don't want to pass it through. So, um, Yeah, so what ended up happening was that Gilead decided not to do it. Um, and somebody did ask me, what do you think Gilead decided not to do it? And I think one of the theory is that it's like abortion pills. It's like you might have this tool, but if we decide to give it to you, it's kind of like allowing you to have that behavior. That's one thing. Um, I forgot how much the drug used to cost for just HIV treatment. Um, so what happened is that the activists and the scientists decided, like, at this point we had like maybe not 3 decades, but we had relationships with researchers and policymakers, so decided to actually make the study without the pharmaceutical. So big donors, I think it was the Gate Foundation and maybe the Clinton Foundation that basically stepped in and basically made the study happen. But the scientists and the activists actually kind of paved the way of how it should be studied and how it should be delivered within time. So, I think like if the pharmaceutical had studied it and approved it, then what happens is that then it has to go through like a whole delivery campaign. So we build it in. So we were so sure that the numbers were going to be exactly what we thought. And within the funding, we wanted to be able to roll it out right away. And it had a goal of 5 years. And we reached the goal within 3 years. But let's say, I can't remember the number. Let's say the medication that was used for um, HIV, suppressing um, the infection of the replication of the virus. Let's say that specific drug, I'm trying to look for it. Let's say it costs 18,000 a year. When this was recategorized um, for PrEP, the drug went for 30,000. So, we have these wins, but then we have this enormously um, fallout. And that speaks to another section of things is that within that we've had this enormous success with our own bodies getting tested for, what became the protease, all this stuff. But then it becomes so expensive. Um, and it taught the insurance company, not they taught, but the insurance company basically have done this model where now you have to take, like, actually COVID, the Paxlovid is pretty amazing that you can take it for 10 days or whatever it is, 5 days. It, they no longer want to do that kind of stuff. So now, like, whether it's diabetes, whatever, it's like we are on this long-term plan. It's like having a mortgage that never ends. So there's a
Yeah,
lot of downs.
I feel you. And like Paxlovid, it has been going through a lot of similar issues these days in that, it used to be, when more people were taking the pandemic seriously, there were government subsidies to help with the cost. And now that that's not really happening anymore, and a lot of people can't afford Paxlovid, and especially for as long as they sometimes need to take it. Is
But
there?
it's still,
Oh,
but
yeah.
but the thing is that even in that scenario, like, I don't know how much is Paxlovid on the market, but you can borrow that money for 5 days, for 10 days, right? You can borrow that money. But with an HIV drug, one single drug mostly is the equivalent of 30,000. But yet our global work is so thick, and I probably don't have even time to go into it. Globally, you can take, like, when PrEP was 30,000 in this country, it was like $60 in Australia a year. And that is because we make it possible, not only scientifically, but we basically pay for it. In the early 2000, I think the Gap had this t-shirt. That's it. It was in in collaboration with the Red Products, which is like the Red Products is basically is with big companies like the Gap, um, iPhone, whatever. So whenever you buy something, it goes to HIV globally. And they had this t-shirt that said 2 weeks. So for every piece of drug that we take at 30,000 is 2 weeks free for another country. Like it subsidizes. Um, so it's a very strange thing. But it's also like other countries don't ever think about how that's possible. Like, we've done a lot of stuff for prep for other countries where they can manufacture it themselves. Um, Yet until it was generic, we ended up paying this level amount indefinitely. And then when we talk about prep, like when you look at the data, I mean, it just they don't put enough distribution, slash advertising for women. I mean, I've gone and spoken in universities like at Bernard, which is, high education for women in this country, and I'll go and ask that question, and in a room of all, nobody takes, and maybe three people have kind of heard it, wasn't sure what it was. Yeah, so yeah, so I have a hard time when people say, well, we have treatments. So women are still being diagnosed today when they have full-blown AIDS, all that.
Yeah, that is just mind-blowing to me. Like, not surprising, but just like it's hard to wrap your head around, just how much work still needs to be done. And that's a big thing that I feel like we are seeing with, both HIV and COVID is like we've made so much amazing progress, but I feel like we also see people having this mental block of like, okay, because we've made all this progress, that means we're done, right? And we're very much not done. Uh, Um, is there anything that you would like to see groups like ACT UP and other health justice groups working on to get the word out, to improve accessibility to medication, etc.?
Hmm. I don't know. What do you think? I mean, how would you prioritize? Prevention is very hard. Um, when COVID happened, when we didn't have the vaccines, I'm trying to remember the first, and second. I think the second by 2021, we were vaccinating, but not everybody had the vaccine. So those 2 years were very, very complicated for me because even though 2020 did not have an actual Pride event, even ACT did the march, but it wasn't a corporate Pride. But people were in Long Island, um, and because there was the shutdown, and then when the summer came, I remember seeing these images where people were in Fire Island completely elbow to elbow, in the pools and everything. And it enraged me so much. And then I would have like the same people I've worked for at that point, 20 years, would repeat me, in which you probably heard, the shaming does not work, right? Um, yeah, so that was really difficult because like now we're also in a different space and there is a discussion what human behavior is about prevention. That's why PrEP is very hard to implement because the notion of you not being physically sick, um, and then there's genuine concern, why am I taking something that could be so toxic when prevention is just always going to be that situation, like whether it's pregnancy or anything. Um, and that's a very, one has to accept that that's always going to be challenging. Um, for me, it's always been really hard about the whole PrEP thing. not only just living how we women also keeps on never achieving that care and attention of delivery is that it takes so much energy, and it might be a cop out where I think like all that money and the percentage should go into treatment and a cure. And as the years went by, I think I am in the minority of thinking that, where people go, well, you have the HIV drugs, you should be fine. Or, you have the mask or you have the vaccination. Having a cure is really the thing. Because if you take the millions and millions of dollars that we do in prevention, um, but if you get infected, whether it's COVID or whatever, it's like if you don't have a cure, that's it, right? Right now, we're also talking about the possibility of not being able to have a good pipeline secure of medication, right? And that's always been my thing. People have always thought that I was, looking at the very negative thing, but I was also saying like a 30 fucking thousand, that is not a cure. And I also think like we have this very, very sophisticated science in the medicine that have benefited COVID or cancer or whatever. So my reach is like you can fucking solve this, but you're not wanting to solve this. So I don't want to work in preventive, which I'm not, and I don't say that like that's not my thing, but that is that is a lot of noise financially, um, psychically, economically, justice. Um, and like for example, when as a volunteer board member of the Treatment Action Group, which is the group that left ACT UP and focus in the science and and on the table with scientists and creating our clinical trials that we wanted. Um, all this is that when we don't look at it in that investment, the noise really, really takes away the responsibility of what justice cares looks like. So I used to say this, I guess the one story I wanted to share a lot, and I try to do it when I speak, is that the story I tell you that when I was in ACT UP, they called for women to get tested, and I think it was like a chess move, right? At one point because it was so homophobic, blah blah blah, and um, then they said, you know what? If we normalize it because it's going to affect other people, we test. If they come test it, then they're in the table. Suddenly, we recognize just a human. But yet, when I go to ACT UP, I just didn't have any support. The women were asked to, the other negative women would decide like what should we study and how should we study. Maybe we should look at this for 8 months or whatever, and maybe then back then you had no 8 months. But that was like because ACT UP had become um also a place where community found home. So it was a more socialized thing. So there was when it had to break out into people really, really trying to survive, you'd be being drowned by all these other things, but never for a solution. So I used to, and I think the notion with people that focus on the science, it is that without a cure and without treatment, you cannot work in anything. You cannot work economics, gender. I mean, the struggle continues to be what we look at because you're just constantly dragging along all these other issues. And I think today, like my struggles at ACT UP are very similar from back then. That has become like a social group. Everybody wants to bring their problem, and the problem just creates more problem, more things to look at, more things to have activities. And when people say, why do long-term survivors don't come back? Because, people in my generation, the clinical trials were not abstract. Like when we say, oh, COVID, in the studies, of the clinical trials, we knew people, it was us, it was our body. It was never abstract. So like when you talk about most diseases, most people don't know who went into those clinical trials. So for me, that is a very, very hard thing because I came into ACT UP, but especially the gender thing became a place where people can come out and feel proud of because we were like taking, and that's a very controversial thing to say, but I think is it is what it is, you-
Yeah, but yeah, that's a lot of like really amazing, insightful, on the importances of the yes and on so many levels. Yes and, yes, X disease might currently appear to mostly affect certain groups, but that doesn't mean you can't say also yes, and it also affects these other groups as well that we should be welcoming of, which unfortunately that intersectionality, like we don't recognize it or accept it as often as we should. And also, like to what you were saying about treatment, like prevent where you can, but as you said, unfortunately, getting everybody to comply with that isn't always going to happen. So it's also important to say yes, and we want to find a treatment for it. Uh,
well, the New York Times actually, if you go back probably, I would say fall of 2020, I think the Daily, I'm not sure there was an article. They talked about like as the vaccines were being rolled out because 2020 they were prioritizing like very sick elderly people. Even HIV like was in the second tier. But it talked about I don't know what when it happened like in the US, the previous pandemic where they the Atlantic wrote about it. I think it was Chicago or one of those places had like some kind of flu that killed
yeah,
bazillion,
Spanish flu in 1918.
something like that. So they had two mayors of the city, and one said we all have to be vaccinated, and the other one just said whatever. So gazillion people died, and yet this group of people that the mayor called it in, where they were just vaccinating people. So that article in the Daily was really, really interesting because the whole Trump thing was already in play, and they talked about it. They got a whole bunch of researchers, and they said, "Is if this directive of vaccinating people is not successful, when we need to, I don't remember. It was like it had to reach 80 something percent. Uh, if we miss that, it said, if we don't reach the 80% vaccination, what's going to happen is that we're going to have 40 years of variants, which each variant you don't know how bad it's going to get, even with vaccines. So that was really interesting because the article also goes into like very deeply Trump areas and try to figure out what were the hesitancies, right? And so you would hear things like the local, you know, small town Pennsylvania, which trusted the five doctors that they have, but suddenly people were hesitant because this dialogue of MAGA or whatever, and the fear of suddenly like they're gonna inject us cameras, blah blah blah. So they were trying to like go, okay, this is what they're hearing. How is it that you can overcome that? And they try to do things on the church. There's at the height of like really bad. I remember in Texas, their Department of Health would actually open um, like secret clinics behind stores. So people that vocally said they didn't believe in vaccines or scared, at one point they were scared, would go into this place and get vaccinated and not say anything. But I think, we did miss it, and now we're it's going to be 40 years of whatever, because we're there.
Yeah, I mean, like, I often say the cliche of those who forget history are doomed to repeat it. Like, it holds more weight and truth than we often like to think. And, you know, even toward the beginning when vaccines were very new and this new wonderful thing, there were people who were scaremongering about vaccines, and we're facing that again. And like you said, we're seeing this, like, because uh, because we didn't ramp up as much and as fast as we could, like, we and didn't take the proper precautions while we were ramping it up. We're seeing things to continue to go through these cycles of getting kind of okay and then worse again, kind of okay and then worse again, etc. And uh, um, yeah, in all your decades of activism, is there anything that you have seen that is a good way to, like, help people see, like, okay, like, these are the things we need to do now. This is the science we need to fund now, etc., to combat this kind of thing.
Well, COVID had an opportunity to be it all, right? COVID had the opportunity to really, like, if HIV changed healthcare to what we have today, I saw it as a potential to like do massive, massive structural change. And honestly, people did not step up to it. We had this thing where like the Ryan White, there's a federal money um for HIV that funds millions of dollars every year to New York, California, and Florida. We were able to do it at the height of homophobia, the stigma, and more importantly, prior to this, it has never been done, and nobody else has done it. So I thought when COVID came, that was going to be, you had like HIV advocates like had this blueprint that really perforated so many levels of of policy, of social justice, science, money. Um, and then you had this one thing that affected everybody, that there was no real, it's not gay people, it's not tall people, it's not short people, it's fucking everybody, right? It had a lot of money. So what you saw that first couple years was how it should be. And that dint of money is nothing. We spend that in more in 3 hours. Um, and that was very frustrating for me to see. Um, and I guess my comment would be is like humans are very, very, very more comfortable in socializing a situation than working into like being super militant and not have like their egos in place and not making more programs that that take time to do and talk about and not stay with it. Because when it comes to illness, you know, really, the solution is going to be obviously a financial solution that needs to step up to the science. That's it. It is not in the orange tea or whatever, it's like at the end of the day, like if you are not lining up, um, to be called, I guess, as a person of civics. And I think that's another problem in the US is it doesn't have like it doesn't have a practice of civic engagement. It doesn't have, and that is a big component about whether education, civics. You go to Asian countries, like we don't fucking behave like this. Like we don't have to have a cold. You don't have to have a cold. It's just thing. It's just a thing that we try to do um, when we are in spaces that we don't know. Um, but the discussions that we let things derail are pretty intense. When you have the other side that is against science, and we'll put like a guy that went to the army and they just have an opinion of what science is insane. Like, do I think do I think like professional scientists peer review, there's no issues? Of course there's issues, but it's not like your uncle making a recommendation. And at the end of the day, also, like, I always try to repeat to people is that in New York City, I know that's not like Pennsylvania. In New York City, we had 800 people on average die for 3 months. If they're going to stick a camera on me, I'm willing to do that. Right? But we don't have that sense of that. We are so much into like, we want to, is that them? I don't want to participate. I am sorry, like for 800, 800 people die every fucking single day. We had trucks, refrigeration trucks in the city. And I get it. When you're in Florida, your social distance sort of, it's embedded and you don't have that sense of care because you're not living on top of each other. Um, and then, I feel like when things hit the ground, it's always New York that actually, or California that comes up with solution, sacrificing so many people, and they get it, right? They get it. They get all the benefits. Like for example, for me was like the fact that people take Paxlovid with 3 generations of people being so fucking homophobic. Here it is. This is a science that, something we took that got us safe, so here it is. Um, and that didn't come overnight. People are so afraid about like new science overnight. I mean, like, why would you be afraid of that? You don't want science to take 30 years.
Yeah, and like that's something that I've like often struggled with, that like especially now that like I mean thank goodness we don't have freezer trucks in the street anymore, but like we're still seeing like you know, thousands of people like becoming disabled or dying, and because it's like not like as visually in front of people, like what do we do? How do we like make that more tangible for people? Because that's what seems to get people moving, is that tangibility. And I don't want it to come to like freezer trucks being in the street again, you know.
Mhm. Well, the
It
problem is that they won't tell us now because I don't think it's going to be the same because a lot of people, while we didn't hit the 80%, we hit enough that we're not going to have that's that amount at the same time. Obviously, I don't know if there's going to be a variant that's going to change that variable. Um, I would like assess, and I think that the same thing about prevention is just going to be a very hard yelling against the wind kind of thing. Um, and in our floor, we're talking about this. I abstained from voting because I also struggle with the fatigue of it myself, right? I mean, I mask when I'm in public spaces and that kind of stuff. And I've like really curtailed like my time out with people. But how do you have dinner with people? And this whole testing thing, I mean, it hasn't changed, right? You can test negative, but you took the subway and within an hour you could be positive. You know what I mean? So, and then I also understand the psychological isolation. I also understand the people that are displaying more um, health damage, that they can't do any of this stuff. And it's terrifying. I flew in 2022, was it 22 or 23, to the AIDS conference in Australia, Brisbane. 20 hours in a flight. Five people were masked. Yeah, and I used to joke, like, if I was not viral suppressed, I could have given somebody HIV. You know what I mean? The guy is like sleeping on top of me. Um, but that's where we are. I went to the AIDS conference at low, and it was a that year was a scientific, it wasn't just a communal, but it was a scientific. It was single digit masking. And and I said to myself, even if you, because it was in Brisbane, even if you came from Sydney, which is like an hour or whatever, all of us had to take a plane for at least 10 hours, and nobody was masked.
Oh man, yeah,
These are
like
the scientists. These are the
yeah.
scientists, researchers, the top of the line. 2022 or 23, I can't remember now.
Yeah, yeah, some of my friends have started calling it the Semmelweis effect, precisely because, Semmelweis was the guy who really popularized masking, but like when he was trying to advocate or not popularized masking, popularized hand washing, I can talk. He really brought it to the forefront that like, hey, hand washing is this basic hygiene thing that's gonna protect our patients from getting whatever germs we're carrying from the cadavers we were just working on. And like during his lifetime, like even other, doctors and healthcare professionals were poo-pooing him, but it eventually came out like, hey, we really should be doing this, and we're seeing a lot of that today where like the people who you would think know better aren't doing better. Though thankfully we do still have some doctors, nurses, and other healthcare workers doing the do and marching the march. But to your point, a lot of people are also very fatigued uh,
Well, the
by
hospitals too. I mean, the
yeah,
hospitals in New York have dropped it. City
yeah.
MD, which, do see a lot of people that are transiting from all over the world as like the care, like if they get sick, they're not wearing masks. So
Yeah, and uh, as someone who has, I always really appreciate your insights on stuff like this. As somebody like who does the do, but also openly talks about things like feeling fatigued. You know, is there anything that you've thought of that where it just makes you think like, oh, if only people would do or say that or act this way, it would make this easier or less fatiguing, or at least relieve some of the fatigue. Yeah.
prevention is where it is. Like, prevention is a very complicated thing. Um, I just feel like one has to do it, but also one has to be realistic that it only has a certain capacity, um, and where you have to direct a lot of your work is in where is the pipeline to treatment. I mean, I don't think I'm not never gonna be masked in the subway. Like I feel like I get like disgusted when people yawn. I mean, or fall asleep or whatever. I mean, I just like just that in itself. Um, and I don't know how to make people more scientifically aligned in terms of like when no, it's like it goes back to civics. It's like if a war broke out that completely was going to take you out, what are the things that you want to do to line up to volunteer to do this thing so you can stop it? So where's that line for people that have COVID or could have COVID? I mean, at this juncture, we're ACT UP, which includes yourself in that dialogue of where it is. In the last month and a half, we are seeing the data of the 3, 4 years, right? Of people that didn't vaccinate or vaccinated. we know that this immune thing um kind of falls in the line like what's it like long-term infection that keeps on deteriorating. But because that's what I was saying is that when HIV exploded, people were infected long enough that the communal bulk was expressing what the deterioration was. I don't think that's going to happen here because we have better health care. So that urgency will, I don't think it's going to reach that critical thing. Um, so as activists, I do think that circling back how um you could be a stakeholder with agency to push the science is really the only thing. It's the less sexy thing, yet it's the most important thing. Because you could be frustrated endlessly with prevention and being in the street. You could get funded to do that, but also it's a performance thing, right? I think like a lot of people that want to have this like um spaces where we think we're giving care and it's kind of like giving care for that 2 hours, and it's a lot of investment. And if you're not in the part of the science of it, those 2 hours can the investment could look very differently. But I don't know who's doing that in COVID. I mean, there's people doing it for COVID for sure, but it's not like this, like, it's treatment and action group is doing that. They're making sure that the clinical trials includes a diverse of people. Um, I don't know who's safeguarding that and doing that.
Yeah, I know there are some people involved with NIH Recover, who are doing research on COVID, but I've also heard, both patients and researchers express frustration with, whether like oftentimes I think including with NIH Recover, like the parameters for what they count as long COVID, for example, are too so narrow that they exclude a lot of people, or some researchers I heard talking about some of their research over the course of 2025. Some of the struggles are finding people who have never had COVID before so that they can have a sample of people who haven't had it to compare against and all that stuff. So it's a big struggle. Yeah, on that note, what would you like to see people both in the HIV/AIDS space and in spaces like the COVID space? What would you like to see people do more of or do less of?
Hmm. Well, the more is still the same message. It's like if whatever situation you're not navigating into the signs of it, then you're gonna lose out. And I think like one can tell the story like with cancer is super difficult because first of all, there's many type of cancers. It's hard to have a unify discussion. Um, but a lot of the science, the basic science, the structure has been done through a lot of suffering. So I wouldn't say like, it is that kind of thing where you're coming from nothing. Um, the whole anti-science thing and having what we have as a president, we're gonna lose a lot of lives. So that's what I would like people to always focus, because that's the only thing that's gonna bring the justice it needs, the survival possibility. I don't know how to do it per se in the sense that we have RFK right now. Um, Yet I think all like in terms of science, I think to me, a lot of the stuff is reachable. It's just that there's just no focus financially to do that. And I'll say this to you as well, that about maybe 5 years before COVID, where my population of HIV positive, everybody was content with the treatment, and I was the only one. No, we don't have a treatment, blah blah blah, and everybody's, oh, you just don't remember how bad it was. Blah. Is that we're no longer a commodity. So what we had as power 20 years ago, we don't have it the same. So it is hard also for us, as we're dying off as well. So that's like very clear to say that. Is that I don't know if activists will have the same role um as HIV had. And that's I think that's also okay to just like understand that you don't want people to have the same suffering and stigma. But it took that. It had like, people come to ACT UP and they go, oh, we want to do the same thing or something, that sometimes you cannot replicate that. And sometimes you go, you're lucky you don't have to replicate that. But it takes that to do what happened. I mean, going back to like gay men always get criticized for all this stuff, but certain, especially certain gay men that were very loud, but they also grew up in a world where nobody told them no. So they were like, when somebody said, you cannot be in this meeting because you don't have the knowledge, and they were like, they would not even hear it. Like for them was like like they were just so tone deaf because the death of who they love and how much they were going through. They didn't hear it. They're like, no, 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 I'm going to be in this table. I'm going to be in this table. I'm going to be in this table. And I'm going to fucking outsmart you in the content. A lot of men did that. Like our science director at Treatment Action Group is one of the shyest guys. He came to New York to be a DJ from the UK. He arrives here and is like the height of everybody dying. He never like was a scientist, but he today in the ecosystem of HIV research, he is adored, adored. He has to be in the room, like people, and he like studies everybody's, like, anybody that is making a step, he knows about it, he can speak it, he knows the science. He taught me basic HIV science, like I mean, I didn't have Mark do it. Richard was far more into the science, but he didn't know how to like make it easy for you to understand because he just somehow understood the complexity. But it is that sometimes like people understand what it takes and they won't stop. And they like Richard has never become a DJ. Yet he sits in the office or in his bedroom because he's also trying to beat COVID. Like he's the only one when I go to the conference, he's wearing a mask. He won't eat. He won't eat at all. He will leave the conference and then eat at his house. But he's not like any of us sloppy. We're masked 4 hours and then all of a sudden we want to have coffee and chit chat. No, Richard is like, he's there for his speech. He wears his thing. He would not have a glass of water or anything. And he's one of everybody. That's it. Um, yeah. So you can't get him to go anywhere. He'll take a picture without a mask away from you, but that's about it. Um, and there's very few Richards. But what I'm saying is like that kind of sacrifice of like being able to scale up in your scientific thing, that's not for everybody. I don't have that full skill set. And um I actually want to ask you, were you an ACT UP in, was it 24? No,
Yeah,
2024? Okay.
I joined February 2025, so
Oh,
coming
so
up
it's
on a
after.
year now. No, January or February, so I maybe a year now.
So you weren't with when a whole bunch of COVID people. How did you find out about ACT UP?
Yeah, the funniest story is, yeah, it was definitely after the drama in 2024, but I found out about ACT UP in part because I was working with Jews for Racial and Economic Justice, or JFREJ, and a few of us had been pushing JFREJ to adopt some, like, you know, COVID consciousness and science into our activism, which JFREJ is pretty darn great about requiring masks at most in-person meetings and such, but like a bunch of us had wanted to do some activism around it, and basically one of the members of leadership came to me and said, okay, during this leadership meeting I was talking to people about y'all's desire to do that, and they said, like, okay, we might be willing to do that, but only if you can find other organizations that we can partner with who are doing the bulk of the work, and, we can kind of latch on. And so I had been looking around for health justice organizations that, had a chance of doing that kind of thing, happened upon y'all and was like, well, like, let me hop in on one of these Monday meetings and see what's what, and ended up staying because y'all are awesome.
Do you know any of the other people that were there before that were part of the COVID
I've
justice?
m- I've met one or two people, but yeah, other than like Victor and Brandon, who I think were both around during that time and are obviously still involved with ACT UP, I haven't had any really, deeper long conversations or anything, and don't really know other people who are around then too well, other than the people who are still currently in ACT UP.
But your work with the COVID group, I mean, who's in that group right now?
Yeah, let's see. We've got, I think,
X is in it.
yeah, yeah, X. We've got Morgan. We've got Jack, who's very new and has been like really wonderful with research. Um, I think Rachel, who's also still very, very new, but she's also been amazing. Marcelo has been helping with stuff. Yeah.
But you don't know any of the people that were there in that 24 group.
I don't think so, beyond again, like people who are, still in ACT UP who were there at the time.
So you're staying because you still think it's a better space to work on this than other places?
I think so, like
Wow.
we have our contentions and we all have our strong opinions, but I think it's a pretty wonderful group.
How are other groups?
Yeah, I feel like so many other groups have, like either partially or completely abandoned the idea of like masking or requiring masks, etc., which is, I think, part of why a lot of us still stay.
But if that got overturned, what will you do?
Yeah, I don't know. I don't know what I'd do. It's something where I will have to cross that bridge when I come to it, and I'm hoping that sticking around means that it won't come to that.
So you're saying that you will stay in ACT UP as long as ACT UP does this prophylaxis stand.
Uh, at the very least, and yeah, like it's something where I'm hoping that, if we continue having our meetings on Zoom, or whatever else, like it's something that I can continue with. And I think for a lot of people, unfortunately, that's, the big question is, can I continue working with X or Y group? And, uh, um,
So what is your goal?
yeah.
Let's say even if I don't know the meetings are successfully masked or
Mm,
the outside is, but what is it that you're working on besides that? That's a prevention
mm.
adherence practice, right? So beyond that, what are you looking to do and act up?
Hey, yeah. Oh, beyond just like making sure it's safe for me to continue being part of ACT UP. Bleh. Sorry. But yeah, like yeah, a lot of my brain has been taken up by that. Like, do we keep masking within the organization, etc.
Mhm.
But yeah, like I would very much like to be able to continue like you said, pivot back to, okay, like, uh, um, my dream would be like, okay, now that half our brain space isn't being taken up by that debate, like, can we get back to fighting for the science around treatments, fighting for, you know, uh, health justice and accessibility, etc. You know.
I mean, look, so I'll have the parallel back to into prevention. The we have options of treatment that extend our life. Expensive, blah blah, complicated. It wasn't the condoms. So where you're at right now is you're very much in that negotiation of the preventive thing that when you say to yourself, until that's settled, then I'm gonna go back. So you need to like think about that also, because it's not gonna be, it will never be done. It's like asking teenagers not to get pregnant, la la la, human behavior is very, very frustrating. So as activists, I guess that is my like when people say what would you want? I think you need to profile also that behavior about preventive and not stopping you from working on ultimately what will solve something, whether it's financially, scientifically, blah blah blah. The prevention to stuff is very performative and it just consumes your life also.
Yeah, though I think that's very good advice, though I would push back in saying it's
A very hard
performative.
advice to give.
Uh, yeah, like I would very much push back in saying it's performative because it's like important work, the same way that, the analogy I often use is like, well, it's like driving a car. You want to buckle your seatbelt. You want to drive on the correct side of the road. You want to follow the speed limit. You want to, obey traffic lights and traffic signs. You've got
Mhm.
to do all of those things, not just one of them. And that's all prevention. And does it stop all car crashes? No, but it, reduces them and it makes them less likely to be bad. And it's important to have, but like you said, like we do need to have that yes and, where I
Yeah,
personally
but
find
when it comes to this is the scale is very different, right? Because the whole um buckling up, not driving drunk, there's huge re legislation that is trying to curb that behavior. So, like my kids never been in a car without a seatbelt, right? Because by the time they were born, it was 30 years, but it required government, it required insurance, it required all kinds of shit. Um, but that work about making it a legislation and a punitive thing took decades to do. So, and then, how does that translate? Like, let's say for HIV, like condoms, nobody's gonna fucking be able to do legislation and show up in your bedroom and go, what I mean? And the same thing with the masks. Um, Culturally, I just think it's such a different space than, let's say, in Europe. And I mean, South America is a mess too. But Asian countries just, I, I don't know why we do it, except for for respect of other people. I think the people that are here most for with the mask are people that live in with loved ones that are sick as well, let's say beyond them, that can understand that their role. Like if you have a grandmother or you have a brother or sister or your husband that's very sick, those are the people that are masking. I find it hard, like the stores in New York during this flu coming up, because New York is, still has a lot of tourists. I was actually happy to see that the store clerks were masking, right? But you know that the reason is so multiple. I mean, they are seeing hundreds of people every day from all over the world coughing on them, and they have a job where probably they can't afford to get somebody sick or themselves sick. So I mean, but there's no legislation. I mean, in fact, the legislation is going to go against all of this stuff. Yeah, so I think, like, we can disagree what is performative and how much effort it becomes to have like a cultural change. But more important, I think, would be my advice is like, where does that leave you in the spectrum of finding an actual solution, which is the treatment thing? And, every day that escapes us.
Yeah, and I think what you said earlier about, saying yes and instead of, this then or this or is very important. And I think you actually hit on something with the seatbelt stuff because, and like, I'm certainly not saying that, like, it's necessarily going to be a legislative fix with something like this or, whatnot, but as with seatbelts and as with hand washing, both of those things took decades to get people to do at any level of consistency. And those are certainly preventive measures, and preventive measures are important.
You know,
Goodness knows we don't legislate on hand washing,
the
but you're
gloving
supposed to
thing
do
makes
it.
me crazy. So
Yeah.
there's also a whole like perception of what works. Like you go to a
Yeah.
restaurant and a guy is touching the garbage, taking different plates. The notion you're just wearing a glove, it's so wrong also. I prefer not a glove so the person knows it's dirty. So there's just so many nuances in that. But yeah, um, and I think that that's like things that eke me out about going to restaurants, right? Because I'm like, oh my God, this guy has the same glove and it's pulling. Um, yeah, I think prevention right now, specifically for COVID, is super challenging. I mean, hospital settings, I mean, that's your gauge. I see people doing before going into surgery, doctors and nurses not masking. I don't know what to say.
Eh,
It's like,
Exactly. And like, heck, on that front, we have legitimately been moving backwards because there are certain healthcare spaces where it used to be that, the healthcare workers involved, doctors, nurses, etc., were required to mask, uh, in TB wards, I believe cancer wards were another one, etc. And now you see spaces where that used to be like required and people aren't masking, including the healthcare workers. And I'm hoping that, fingers crossed, it will be, a Semmelweis effect thing where eventually people will be like, oh, dope slap, why did we resist this so much? Because we are literally moving backwards.
it's insane. It's insane. Anyways, yeah, so I guess a good way to end uh, like just meeting up about this is just like, you know, everything a good way to end it is like finding a way to have like maybe a commitment of finding two good trials. And then it's not just a good trials, but then trying to see who they're including. How can you make that trial better?
Yeah, very much agreed. And, one of the big things I'm taking away from this interview is making sure that we're saying yes and not this or this then, but yes, this and thank you so, so much.